Hi, I'm Dr. James Nill, Nill Family Chiropractic and Wellness Center, and today we're going to talk about low back pain. Now, the majority of low back pain that I treat consists of four different things. One of them could be whiplash, which is strain in the muscles that tighten up during a car wreck. It's because you're not looking and seeing what you're doing, and a car comes to get you, and your muscles contract to try to protect the spine. Another thing could be degeneration. Wear and tear in the joints over time causes bones to deteriorate a little bit and cause different kinds of bone formation and disc height loss. Another thing that could happen is you could have a disc herniation where the discs that are in between each vertebrae can actually rupture a little bit and come out and pinch on nerve roots, causing pain to go down the leg. And the other kind of pain is facet syndrome, which you see a lot of times with people with large bellies, which causes the spine, the curvature in the spine, to get a little deeper. And you see it also with pregnant ladies too. So what we're going to do is we're going to demonstrate now about different ways we can actually treat those. Okay, now the first thing we want to do is accommodate the patient to what kind of body type she has. So if somebody was pregnant or had a large belly, we can actually lower this abdominal piece a little bit. That actually accommodates pregnant ladies, and we actually treat pregnant women as they go through before and after birth. But with her, we're going to bring this up. Now we also want to do is next thing to do is put a little heat on here. And what I do for the majority of low back problems is use what we call anodyne therapy. As you can see, that there has little bitty diodes in here. What it is, it's a light therapy that actually gets absorbed by the red blood cells. Red blood cells, it causes it to release nitric oxide, which is a natural vasodilator. In other words, it opens up all the blood vessels in that area, including the lymphatic vessels, which actually helps flush out all the inflammation, which is the main cause of pain down there. So we're going to put this down here, right over the pain area, and a little bit above, and then have it sit on there for 8 to 15 minutes, depending on how long she needs. The next step after we do the anodyne therapy is we actually want to do manual massage. So we're going to actually come in here and we're going to get down in deep and try to massage these muscles. So try to loosen them up a little bit to make the next step a lot easier. Now I can do it this way, which I do with every one of my patients, or I can actually refer to the massage therapy clinic, which is also in this building, and they'll do some real deep tissue. And I always recommend that with all of my patients, because having that deep tissue in there will actually help loosen those muscles up and make the adjustment a lot easier. Okay, the next thing we're going to do is what's called myofascial release. Now luckily this table has a different function to it that you probably haven't seen before. It actually has what's called distraction technique, which you're actually going to hit this and it comes apart. It goes up and down to accommodate whatever I need, and then we release it, and then we use the table to come down to do some traction here. Now this is probably one of my favorite and best therapies that I use to actually help release that muscle in there. It's called myofascial release, and we do this for about 8 to 15 minutes. And then we come in here and we'll go to each joint segment, and we can do what's called flexion distraction technique. And this is actually helping spread those vertebrae apart, just like we did with the towel above, but this is what we do with the low back. And the table can move depending on what the patient needs. So what I usually do is find the area that helps relieve the pressure the most. Okay, after we're done with the flexion distraction, for most of my patients I want to get in here a little bit more and actually do some manual manipulation. And I set her up like this so that way I can get to the back, and I come in and then come down like that. I can do it that way, or I can bring the leg around and pull, or come down here and get some of the other part down. So what it does is it helps release that muscle tension in there, ergo the joint pain goes away.